You know, as metastatic, all our basic treatments class as palliative treatment. I mean, like I'm further away now. I'm up in Mackay, and if there's no hospices available, what happens? I mean, I know there is obviously palliative wards here in Brisbane, and when is the conversation, like if you're here, when does that conversation end up being held? And
anytime.
Anytime.
Yeah. So I'll just, I know lots of people hate the word palliative, and as I mentioned, I worked there for 10 years, many years ago. So it's not just about end-of-life care, but I'll get onto that part as well. They're just brilliant at pain management and symptom control. And although we're great in medical oncology, we would want to refer on to the best people who have that knowledge. So you might get referred well before you're even considering end-of-life care for those very reasons. So that conversation is really driven by you, or driven by the situation that's happening with your care, and where you're sitting in how many lines of treatment you've had, how you're feeling within yourself. Sometimes it's good to have these conversations earlier rather than later, because it can be stressful to think about this stuff at the end. Sometimes it's something that we're all thinking about but not realising we're worrying about it, but once you've sort of made some decisions about advanced care planning, you can forget about it and get on with living.
So palliative care and their ability to step in and manage symptoms, and probably the main thing I get them involved for is pain relief. They have a really innovative way of looking at pain relief that the oncologists are very good at it to an extent, but the palliative care physicians, that's their bread and butter. That's like going to the right specialist for the right advice, and I find them just an invaluable service.